There is a type of chest pain that arrives discreetly, almost shyly, but that can hide a serious risk to your life. Many people, especially those over 50, confuse this sign with tiredness, indigestion, or even simple muscle discomfort. But the great danger lies precisely there, when we let something pass that could have been perceived as an urgent warning from the body. Today, you will discover how to differentiate common pain from a real heart alert. And when we talk about a heart attack, every second makes a difference. That is why, even before going into technical details, you will understand now, simply, what really matters to notice. Stay with me, because many people only discover the pain was serious after losing precious time. And this is a mistake you will not make. This video was created so you have clarity, safety, and the ability to act at the right moment. How to quickly identify dangerous signs. The first thing you need to observe is the quality of the pain. Pain described as squeezing, heaviness, pressure, or a sensation of a band tightening around the chest usually worries more than pinpoint pains, like quick, sharp stabs. If the discomfort lasts more than a few minutes, gets worse with exertion, or doesn't improve with rest, this already lights up an important warning. Another essential point is to notice if the pain is accompanied by shortness of breath, cold sweat, nausea, or a sensation of imminent fainting. These signs together indicate that something serious might be happening. It is also fundamental to pay attention to the behavior of the pain. If it starts in the chest and radiates to the left arm, jaw, back, or even the upper part of the stomach, the chance of it being cardiac increases significantly. Furthermore, any sensation of tightness in the chest that arises during moments of emotional stress, physical effort, or after a night of poor sleep should be taken seriously. The more you know these patterns, the faster you can act, and acting fast saves lives. Before we move forward, if this information is already helping you understand your body better, take the opportunity to like the video and subscribe to the channel so you don't miss upcoming content that can protect your health. Why a heart attack is so treacherous after 50. After age 50, the body goes through changes that make a heart attack much harder to recognize. Arteries become stiffer, the heart works with greater effort, and symptoms that would previously be evident may become more discreet. Additionally, many people in this age group already live with high blood pressure, high cholesterol, or diabetes, conditions that mask signs and confuse the perception of pain. That is why so many people delay seeking help, believing the discomfort is just something passing. Another factor that makes everything even more treacherous is the higher tolerance to pain acquired throughout life. The mature adult tends to endure discomfort for longer, minimizing symptoms that should be investigated immediately. When we add this to a more sedentary lifestyle, accumulated stress, and poor sleep quality, we create the perfect scenario for a heart attack to manifest without warning. Understanding this reality is fundamental to recognize when a simple pain can, in fact, be an urgent call from the body. Chest pain, the types that worry doctors most. When we talk about chest pain, not all have the same level of severity, and knowing how to differentiate this is essential. The pain that worries doctors most is the one described as squeezing, intense pressure, or a sensation of heaviness, as if something were pushing the chest inward. This type of pain is generally not pinpoint. It stays, grows, or spreads. Another worrying characteristic is when the discomfort appears during a walk, while climbing stairs, or even in moments of emotional stress, indicating that the heart is struggling to work. There is also the pattern of pain that does not improve when changing position or massaging the area. If the discomfort comes accompanied by shortness of breath, paleness, cold sweating, or a fainting sensation, attention must be redoubled. Pains that radiate to the left arm, jaw, or back are also classic signs of cardiac origin. Knowing how to recognize these patterns helps to quickly differentiate common pain from those that require immediate action. Silent signs that indicate risk even without intense pain. A heart attack does not always present itself with the strong chest pain many imagine. In people over 50, it is very common for the body to send more discreet signs, such as exaggerated tiredness for no apparent reason. This tiredness can appear when performing simple tasks, like tidying the house or walking short distances. Another silent sign is sudden shortness of breath, even at rest, as if air were not fully entering. Often, the person tries to justify it saying it is just anxiety, but this is a dangerous mistake. Another hidden indicator is mild but persistent discomfort in the chest region, neck, or upper part of the stomach. This annoyance can come accompanied by mild nausea, dizziness, or an unexpected cold sweat, especially in the morning or during moments of stress. These symptoms, when ignored, can quickly evolve into something much more serious. That is why understanding these silent signs is fundamental to act before the situation gets worse. If this information is helping you recognize your body's signs better, take the opportunity now to leave your like and subscribe to the channel to continue receiving content that can save lives. Difference between heart attack, anxiety, and muscle pain. One of the biggest confusions happens when chest pain mixes with symptoms of anxiety. Anxiety usually provokes quick, pinpoint pains that change location, in addition to coming accompanied by a sensation of tightness in the throat, accelerated breathing, and trembling hands. Unlike a heart attack, these symptoms generally relieve when the person calms down, breathes deeply, or gets distracted. A heart attack, on the other hand, tends to produce a deeper, constant pain that does not improve with changes of position or relaxation techniques. Muscle pain, in turn, usually appears after physical effort, poor posture, or repetitive movements. It stays localized, hurts more when pressing the region, and can get worse when raising the arms or twisting the torso. This type of pain does not usually come with shortness of breath, cold sweat, or a fainting sensation. Understanding these differences helps reduce unnecessary fear, but also prevents you from underestimating signs that truly deserve attention. Recognizing the correct pattern is an important step to protect your health. When pain appears in other parts of the body, many people do not know that a heart attack is rarely limited only to the chest. In men and women over 50, it is common for the discomfort to appear first in other regions, such as the left arm, jaw, or even the back. This pain is usually described as heaviness, pressure, or burning, and can come accompanied by a strange sensation, as if something were pulling the affected limb. Ignoring this type of radiation is a common and dangerous mistake, as it can be precisely the initial sign that the heart is suffering. Another important manifestation is pain that appears in the upper part of the stomach, often confused with gastritis or indigestion. This discomfort can come with mild nausea, frequent burping, or a feeling of fullness, even without eating much. In situations of cardiac risk, this abdominal pain generally does not improve with common stomach medicines. Therefore, whenever this type of discomfort comes accompanied by general malaise, cold sweat, or sudden weakness, care must be redoubled. Recognizing these signs outside the chest greatly increases your chance of acting in time. What to do in the first 60 seconds of heart attack suspicion. If you feel suspicious chest pain, accompanied by shortness of breath, cold sweat, or radiation to other parts of the body, the first 60 seconds are decisive. The first action is to stop everything immediately and sit in a safe place. Avoid walking, climbing stairs, or trying to tough it out. Breathe slowly, keeping the body stable, and observe if the symptoms continue or intensify. In many cases, this simple care prevents the situation from getting worse while you ask for help. The second step is to call emergency services immediately, even if the pain seems bearable. Do not try to drive to the hospital. This can put your life and that of other people at risk. While waiting for help, stay calm, and if you have a previous medical prescription, use the medication directed for chest pain situations. But never take any medicine on your own. Speed in calling for help is what differentiates a scare from a serious emergency. If these guidelines are helping you understand how to act at the critical moment, take the opportunity now to like the video and subscribe to the channel. That way, you stay protected with essential information for your health. Common mistakes that make many lose precious time. One of the most frequent mistakes is trying to wait for it to pass. Many people believe that chest pain is just tiredness, gas, or stress, and let time run. This wait is dangerous, as a heart attack can evolve quickly, causing irreversible damage to the heart. Another mistake is taking medications on your own, like painkillers or stomach remedies, thinking this will solve the problem. These medicines only mask the symptoms and delay the search for specialized help at the moment it is most needed. Another grave mistake is trying to drive to the hospital. Even if the pain seems bearable, the risk of losing consciousness at the wheel is real and can cause serious accidents. It is also common for the person to call a family member first, asking for an opinion, instead of immediately calling emergency services. This indecision takes minutes that make all the difference. Recognizing these errors and avoiding them is an attitude that can save your life or that of someone close. Exams that identify the risk before the pain arrives. The electrocardiogram is one of the fastest and most efficient exams to evaluate heart health. It records the heart's electrical activity and can identify alterations that indicate a risk of heart attack, even before any pain appears. For people over 50, performing this exam regularly can reveal silent problems that do not generate immediate symptoms. Another important exam is the stress test, which evaluates the heart's behavior during physical effort and shows if there is a limitation in blood flow. Besides these, blood tests that measure cholesterol, triglycerides, and inflammatory markers help identify risk factors that go unnoticed in day-to-day life. Coronary calcium scoring, done by CT scan, is also a valuable resource to determine the presence of plaque in the arteries. These exams, when performed periodically, function as a kind of advanced map, allowing interventions before the problem becomes an emergency. Simple changes that drastically reduce the chances of a heart attack. Small changes in day-to-day life can have a profound impact on your heart health. One of them is adjusting your diet, reducing the consumption of foods rich in saturated fat, sugar, and salt. Prioritizing vegetables, fruits, whole grains, and lean proteins helps keep arteries clean and the heart working with less effort. Another powerful change is including light walks in your routine. Even 20 to 30 minutes a day already makes a significant difference in circulation and blood pressure. The second step is taking care of sleep and stress. Sleeping poorly increases pressure and overloads the heart, while constant stress releases hormones that leave the body in a state of continuous alert. Simple techniques like deep breathing, breaks during the day, and even quiet conversations help reduce this internal load. Small attitudes, repeated every day, form a powerful barrier against heart attacks and protect your health in the long run. If this content is showing you practical paths to take better care of your health, take the opportunity to leave your like and subscribe to the channel. That way, you continue receiving guidelines that strengthen your quality of life. How to take control of your cardiac health. From now on, you already know how to recognize the main signs that differentiate common chest pain from dangerous pain. You also understood how a heart attack can manifest in discrete ways, especially after age 50, and how small symptoms can be serious warnings from the heart. The knowledge you acquired here puts you in a much safer position to act quickly, avoid common mistakes, and seek help at the right moment. Information is, without a doubt, one of the most powerful tools to preserve health. And more than recognizing the signs, you discovered which simple habits can drastically reduce the risk of a heart attack, strengthening the heart and increasing your quality of life. Now is the moment to apply every guideline, observing your body with attention and seeking regular medical follow-up. Taking care of the heart is not a difficult task, but it demands daily commitment. Continue following the channel's content to always stay one step ahead when the subject is health and prevention.